The first and the most common and it's still a contraceptive is abstinence. Yeah, abstinence is a contraceptive. It is. Hi, and welcome into my bed with me, Dr. K. Today, I really need to talk to some of you because I know all of you who are watching, if two of you, one of you is using a contraceptive, what is the other one doing? So I'm talking to that other one who's not using a contraceptive, and the one who's using a contraceptive right now, I want to give you a few details about what you're using, what effect it has, why the importance, and why we really tell you guys you need to use a contraceptive if you're sexually active. So contraceptive, first of all, I will start with other names that we use for contraceptives. We use family planning, which is a bit easier for more women in Africa, where you don't want to say contraceptives, and I'm not sure why, but family planning is the other way we do use that to explain what a contraceptive is. But basically, a contraceptive or a family planning is any method that you use to prevent or be able to prevent pregnancy or space your childbirth. Between one child and another, you need to give them some time. Why we do give these options for different methods is because it's very important for you to be able to give birth, have some space in between one child and the other, because you need to give space and you need to give a lot of attention to your small baby, breastfeed them in good time, be able to give them attention, nurture them up to a certain time so that you can introduce another one into the family. It's also very important because you are able to manage your family very well in terms of financially. I think at the beginning of this series, we talked about when you should be ready to get pregnant and all that. We talked about financially and emotionally. It would be important to actually have space in between children so that you can treat them well, take them to the university in good time. All these things come in together. In the whole country and in all countries in the world, contraceptives are encouraged because it's a country depends on the population in terms of the financial stability increase. It all goes up from just your individual family to the country as a whole. So contraceptives are very important, not just to you, but also to your country and how the country survives and does its things and management and even planning. So that's why we talk about contraceptives. And you'll ask me, which contraceptive is good? Which one is not good for me? And that's a very good question because there's no one contraceptive that fits all. You who's sitting there, you're two of you, maybe you're sitting, you're two ladies watching or just one person watching, whatever I'll advise for you and what you choose will be totally different from the other person. So what we do is we give you information and then you have a right to choose which one works best for you and which one goes well with your body. So there are different types of contraceptives that we do offer in the hospital. We do have first of all, we have the natural methods that you can use at home. They're not necessarily controlled in a way that we use medication or put an instrument inside you or do anything, but there are different ways you can do it. The first and the most common and it's still a contraceptive is abstinence. Yeah, abstinence is a contraceptive. It is. I would recommend this for those ones, of course, who are not ready to start having intercourse. If you've already started and you want to stop, the best way to not get pregnant is just not to have sex when you're not ready for it. So you're protected from pregnancy. So that's one of the options you can decide to do as a young person. If you're not yet married, you can practice secondary virginity, whatever it is, that's still a way to prevent unwanted pregnancy. Second natural one, if you are actively having intercourse, you can decide with your partner whether you can calculate your number of days and the time you're having your period. That time in between, especially from day 8 of your period, remember you start from day one of your period The first day of your period is day 1. Then as you continue, when you reach from day 8 onwards up to day 21, around that time, there's a chance you can conceive, especially on the 14th day, between 2 days before and 2 days after. I know it's a lot of details, but right in the middle of your cycle, that's the time you can conceive. So some people use their days. They decide this time I am not safe, I can get an unwanted pregnancy, so I'm not having sex between this date and this date, depending on your cycle. That's another natural way of doing it. The third natural way of doing it, you've heard of something called coitus interruptus? Yep. But I promise you it is not 100% because not every man is able to interrupt their sex so that they can ejaculate outside. Not everyone is able to do that. You have to have a very, very disciplined person to be able to do that. So those 3 natural ways, they are possible. You can use them if you know you're very disciplined at calculating your days or your partner is able to ejaculate outside. But again, they are not 100%. They have failure rates, and the failure rates are very, very high. So now, because you know that the failure rate can be very high, you can now consider the other ways of contraceptives. This is the ones we offer you in the hospital. For example, they're divided into different groups. We have the ones that contain hormones, and there are those ones that do not have any hormones, but they could be put in your body in a way that you're preventing pregnancy. For example, you have the hormonal ones. The hormonal ones have hormones that change your cycle, change the way you ovulate if you're ovulating, and then it prevents pregnancy at a certain point. For example, there's the combined oral contraceptives, which contain estrogen, a hormone called estrogen, and another one called progesterone. The two of them, the way they're combined, if you take them every single day, there's a way it prevents pregnancy. Another one is a progesterone-only pill. Take it every day. It only contains progesterone, also prevents pregnancy. Another hormonal thing that you can use is injectable. I think you've heard of something called a depot, which is put inside your muscle, and it can stay up to 3 months before you get another injection. So most people will prefer that one where they don't have to keep on remembering, oh, I have to take medication this time. So you take it after 3 months. There's the implants, which are of different types, and I'll discuss them in a different video. Different types of implants. Most of them are progesterone only, and they're also used in the same way, can last up to 2 to 5 years, depending on which one you do get. Another hormonal contraceptive that you can get is the emergency pill. It contains very high doses of progesterone hormone, and this emergency pill is only taken when you have an emergency. That's why the name e-pill, although it does have several names. It's called the morning chocolate, the morning after, now it's called the sweet choc. I don't know, there's so many names that you do call it. Unfortunately, because it's used only when emergency, we now tend to have a lot of emergencies every Saturday, every Sunday, every Monday. Let's avoid doing too much of it, but I'll talk about that in detail. But it's only for emergencies, only for emergencies. Those are the ones that are hormonal. There is an implant that you put inside the uterus, which contains progesterone. And this one is also very good. We prescribe it a lot for those women who do get heavy menses. And I'll discuss it also further, because I know that it confuses people between the non-hormonal and the hormonal. But yes, there's a hormonal IUCD that exists. So let's move to the non-hormonal ones. And I know many people will want to know about the non-hormonal because they tend to not change a lot about your body. And they're very, very important. And they do nothing, like literally nothing to your body to change your hormones. But they do have some side effects. Like, for example, the coil, which is also called the IUCD. And there are many types. It's not just the copper one. There are also others that they don't have copper and are still very, very good to use. So those ones, especially the IUCD, it's inserted inside your uterus through the cervix, through the vagina, through the cervix, and you're able to prevent pregnancy just because it's inside your uterus, but you still have your periods regularly the way you expect them to be. Another one is the condom, which is, you have the male and the female condom. The male condom is very good. It has 2 ways. It protects you from STIs, STDs. together with pregnancy. And at the same time, the diaphragm, which is also the female type of condom, which is very, very good. I would really recommend it to those people who are not sure whether they can do abstinence and yet they are not in committed relationships. You might want to consider using barrier method, which protects you from both STIs. And we will be diving in more into more of the contraceptives and in detail. So you don't want to miss this, guys. You don't want to miss this.